Hello, everybody, and could I welcome you to the Outbreak Management Advisory Board. I won't go through and do introductions, as hopefully everybody's names will be visible on the screen for those who are either watching and joining us live or are watching back on the Council's YouTube channel. And just to take the opportunity at the start to thank everybody for their participation and time in making this outbreak board, and indeed others that we've held. As all of us here and those watching at home will know, the last few weeks have been quite eventful, to say the least. But I know that despite the uncertainty and lack of clarity at times, our public health team, together with partners across the city, continue to do an excellent job in making sure that residents are informed and protected. Unfortunately, as others know, COVID-19 infection rates in the city are rising and above the national average. And obviously, we have seen that in other areas of the country, which again reflects why we can't be complacent in the coming weeks and months. Last week saw York placed in the high level of the new 3-tier restriction system. This, of course, represents a range of further challenges to residents, to communities and to businesses in what has been a difficult year. However, again, I'd just like to highlight and thank all of those residents, visitors and businesses who I know continue to work hard to adapt and adhere to the new guidance, doing their bit to keep the city, each other and their families safe. I'm happy that following months of lobbying and hard work from the public health team, that a localised tracing operation will be launching tomorrow. And I'm sure you'll hear more about that later in the meeting. And this will go a significant way to support the centralised programme and aid in our local efforts. Fiona will give you, I understand, more of an update on this later in the meeting. But it is worth noting that we will keep actively working with partners across the city and the region, particularly to lobby for further financial support for that comprehensive and effective implementation of both a national and local test and trace system. And we will also continue to call on the government to deliver more support for local public health teams and businesses, as well as more effective communication and partnership between central government and local teams. As you will have all seen represented on the news over the last few weeks, communication and cross-government engagement does continue to be an issue, and it's absolutely crucial that local teams are trusted to use their expertise and knowledge to protect the areas that they know best. And I've written this week to the Health Secretary outlining these concerns and also calling for that additional support to be granted, and I'm sure we'll continue to do that over the coming weeks and days. I'll finish there. And just to note a couple of apologies before we start the agenda items. We've had apologies from Amanda Hatton, but we have Maxine Squire attending as substitute. So welcome, Maxine, and thank you very much. And we've had apologies from Mike Padgham from the ICG. So that then leaves us on to agenda item 1, which is declarations of interest. If anybody has any interest to declare, you can raise your virtual hand. Those watching won't be able to see, but I'll bring you in, or please wave at me. I can't see any, so we'll say that there are no additional declarations of interest to declare. Agenda item 2 is the minutes of the meeting that was held on the 30th of September, and also actions arising. And what I'd like to know is whether you're happy to sign off the minutes of the last meeting, and you'll see from the action log that those actions that are complete are on the spreadsheet that you've got. But equally, if anybody wants to give an update against any of the actions from the previous minutes, please take the opportunity. So I'll first say, are there any updates from the action logs that anybody would like to give? And if not, if I could please see those in favour of accepting the minutes. Thank you very much. So that's a clear majority in favour of that. So we'll note the minutes from the last meeting. That then takes us on to agenda item 3, which is the regular update about the current situation in York. And Fiona is going to lead us through this presentation. Fiona.
Thank you. So in your packs on page 23, you've got the latest update on the data. So I'm only going to briefly just go through that. So as you'll see from that paper, our 7-day rate of cases per 100,000 population is currently at 279, which is higher than both the regional and the national averages. And what you'll also see there is that our positivity rate is currently standing at around 18%, which is significantly higher than the national and regional positivity rates. And I just wanted to say a little bit about that, because it's one of the indicators that we do monitor. So in terms of what that means, if you have a high positivity rate, it generally means that you may want to consider doing more testing, and also that it is an indication that community transmission is high. It's difficult to know, what is a high positivity rate. So obviously we know we're higher than the rate in England and the region, but in terms of putting a rule of thumb around what is a good positivity rate to have, the World Health Organization back in May recommended that we should be trying to keep the positivity rate to below 5%. So that gives us an indication that we should be concerned about that indicator. Just in terms then of what we know about the areas that are most effective. So we know that we do have cases across all of York, but the area of Fulford, Heslington and the university is where we are seeing a higher rate of cases. And then we've given you some information in that paper around the age profile of cases. So what you've got presented there is age profiles before and after the easing of lockdown back at the start of July, where we saw a shift to a younger demographic testing positive. Just to give you a bit more detail of how that's been playing out in the more recent weeks. So I've looked at the first 2 weeks of people that tested positive, the first 2 weeks in September. At that time, about 3/4 of our cases were in the 20 to 60 age range, and that was fairly evenly split between the 20 to 29s and the 30 to 60 age groups. And the rest were mostly in the 10 to 19 age group. The 60 plus age group, which is the group that we're perhaps more concerned about, in those first 2 weeks in September, we had about 7% of cases in that age range. So then if you fast forward and look at the data for the first 2 weeks of October and see how that's changed, what you can see is we've got about half of all positive cases in the 20 to 60 group, and again evenly spread between the 20 to 29s and the 30 to 60s. And the area where cases have grown is in that 10 to 19 age group, which now accounts for about 40% of our positive cases. So the positive point from that is that 60 plus age group, the proportion of positives in this group hasn't gone up dramatically, so it's now 8% within that age group. So we're not seeing a big increase in the older age groups, which would be of concern to us. And then at the bottom of that page, what you've got is some data from the Test and Trace National Service, which shows that for York, about 78% of people in York that have tested positive for COVID have been successfully contacted by Track and Trace, and that has stayed broadly consistent. In fact, we've seen a slight increase up to about 81% of contacts in recent weeks being contacted by that national service. So I'm happy to answer any questions on that if anyone has anything.
Thank you very much for that, Fiona. So more than happy to open it for questions or comments. And one from me, Fiona, was obviously we've seen other areas move into tier 3 restrictions. What work is being done here regionally, nationally, to, in a sense, learn from their experiences, particularly as areas that have much higher rate of infection than we do. So, for example, South Yorkshire this week.
I don't know if you want to answer that, Sharon, in terms of, because obviously the directors of public health regionally have regular conversations, and obviously all in different tiers across the region.
Yeah. So I was actually on a call before this meeting with the Chief Medical Officer and directors of public health across England. And many of those DSPH in areas where, that are already in tier 3 or are hovering on the edge of that, have said that it's really a basket of measures that they are seeing are starting to have an impact on the number of cases. That it's not one single thing that you can do, but it is, a range of interventions. The indicators that are likely to put areas into a higher tier. Obviously, the number of cases, the number of positive cases in an area is looked at. The positivity rate, as Fiona's already described, is looked at. They also look at the age range of cases, and there are particular concerns if the rate is going up in the older age group, because we know that the older you are and people with long-term health conditions are likely to be more adversely affected if they get COVID. But they also look at pressures on the NHS as well. So it's not one single indicator that pushes an area up. They're looking nationally at the numbers now, but also looking at the trends and trying to predict whether the measures that are in place in a particular local authority area now are likely to impact on preventing those numbers rising, and of course protecting the NHS as well. So at the moment, York has gone into tier 2, as we know. If we manage to keep the numbers in older people stable, if we can address the positivity rate and bring that down, and protect the NHS and not see lots of COVID related hospital admissions and also care homes, then I would suspect that we may stay in tier 2, but it just depends on what happens with all of these indicators, really, which is why we keep saying the importance of working together as a city. All partners, residents are partners as well in this, is so important.
Thank you very much to both of you. Alison.
Thank you, Sharon. So I understand that the majority of cases are for under 30s at the moment, but that will eventually spread to the older people, won't it? I think I've heard. So what's the time lag? When do we need to start really worrying about our older people being affected?
So we tend to look at the data trends over a 7-day and 14-day period, although obviously we're reviewing the numbers daily. So as Fiona has indicated in the presentation, our numbers for older people are staying fairly stable at the moment. And provided everyone in York sticks to the rules around, hands, face, space, people are obeying social distancing rules, and now we're in tier 2. It's about people not mixing in other households indoors. All of those measures, if they're robustly followed, will help protect the older age group. And so what I hope to see is that those numbers in older people will stay relatively stable. That's the hope anyway. Obviously, if the measures aren't implemented as thoroughly as we need them to be, and we see those numbers start to go up, then that increases the risk of York being put into tier 3 restrictions at that point. So it's not inevitable that it spreads into the older age group. But you're right, Alison, we need to keep an eye on that and monitor it very carefully.
Thank you. Julia.
Thanks, Keith. I suppose the stats are really interesting around all of this, and I was wondering whether we've got any insight into the behaviour of different age groups. So for example, the over 60s are well aware now that they are at higher risk if they get the disease, and one imagines, but I haven't seen any data around all of this. Therefore, they are being quite cautious. A lot of them are being quite cautious in following the guidelines and following the rules. And that includes, talking to sons, daughters, grandchildren, and all of the rest of it. And so I'm interested in those sort of dynamics within households around and the types of households we have in the city. So, households where there aren't any people at age 60, and the propensity of that virus to spread to that older age group. And if we've got any estimates around that, because I just wonder whether actually we will see that increase into that age group, because actually there may be protective factors in society around at the moment. I don't know.
So I don't know, Fiona, do you want to come in on do you want to start us off?
Yeah, so it is a really good point. I don't think we've got the answer to that locally in terms of what that situation, what that looks like in York. Obviously Claire's team have done some work in comms in terms of understanding how well the messages are understood and how much confidence people have around those messages, but then obviously understanding a message and then that translating into how people behave are two very different things. So there has been some research done nationally to look at that, but obviously that doesn't necessarily translate to our local population, so we don't have that local data available.
I suppose what's behind that then is this is a trade-off, isn't it, between the NHS, the economy, and risk of serious illness and mortality, and I suppose it's trying to sort of understand how you make that assessment. What we know is that young people don't generally get seriously ill, and so if a lot of young people in terms of incidence are getting the disease, that might not translate into significant issues, and we might end up with very challenging economic measures that might not have been needed, if you see what I mean. I'm just trying to understand that balance.
So, I mean, we have Sally and Andrew on the call as GPs, so I'd be interested in their experience. But from what I understand, from our data and anecdotal information that we have, that we hear, is that we can't put the blame on any particular section of the community and say, oh, it's you're the cause of this because you're not following the rules. What we can see is that because we've got spread through social contacts and household transmission. We have adults who aren't obeying the rules in York, as well as young people who are perhaps aren't as stringently following the rules as they should. And it's across all of York. So we can't say, well, if you're a professional person, you're more likely to follow the rules than if you're, from a lower socioeconomic group. We're not seeing that. And so I think my message really to residents of the city and people who work in York and visit York is everybody needs to do more to protect themselves and to protect others. And that message is a generic one that needs to go to everybody. As Fiona said, we really don't have any real indications that we can target one particular group. But I'd be interested, from a GP perspective, what you see coming through your surgery doors, whether that plays out what you're seeing, or whether you have a slightly different view.
Thanks, Sharon. I'll bring in Andrew or Sally if they want to come in. For me, Julia, part of that is you need that really effective national and local and trusted test and trace service, and you need the enforcement measures for those who are not following it. But you need the confidence in the system so that those that can follow it can continue to work, support businesses, and as you say, have that trade-off to still maintaining a successful city. And I think it's a real challenge nationally, and I really hope that these local test and trace schemes that are beginning to pop up like ours will really help and supplement that, and that we will learn lessons nationally about how and who and whether necessarily we've been doing that in the best way possible, because until you get those types of systems in place that work and are trusted, the lockdowns and regional lockdowns are going to continue to be a sort of really blunt and not particularly necessarily effective way of doing it, as you say, to maintain that right balance. But Andrew or Sally, did either of you want to say anything? Andrew.
Yeah, I would echo what Sharon is saying. We must be careful that we do not go down the route of division. If you take a look at other countries around the world that have handled COVID well, look at South Korea or Taiwan or New Zealand, there's a lot more social cohesion. And here in the UK, we had strong social cohesion early on in the first wave, but pandemic fatigue is setting in. So it's important that all of us collectively continue to push on that message of a new norm, and the new norm is the hands, face, and space, and all of that. What we are hearing from some of our practices is that some patients are increasingly less compliant, let's just say, with the public health advice and coming into surgeries. We know in the emergency department, activity levels are much higher now, with more people coming in with stuff they wouldn't have come in the first wave, with more minor ailments. So there's certainly a gradual shift that we are seeing out there. And it's how do we get across the message to the public to, well, I guess for everyone to up our game again and stick with it. It's really, really tiring, but we need everyone to stick with the plan.
Thank you, Andrew. Mark.
I just wanted to pick up the thing around understanding the rules, because that is something that certainly some of the big employers probably see, is that people are just confused necessarily, especially around self-isolation, members of the household, positive versus negative tests, and what do I do? And we may need to pick that angle up as well to avoid the unnecessary kind of spread where actually it has been, but people are not very clear on the rules, go back to work. And not because they don't want to be complying, they just simply don't understand.
Thank you. I know that Claire, I'm sure I can see you writing. I'm sure you'll pick up some of these questions in that next section when we look at communications as well. Anything, Sharon or Fiona, you want to come back on at this stage? So we'll pick up that question, Sian.
Yeah, I think I just wanted to echo the comments around a bit of pandemic fatigue, and a lot of the comments we're getting at the moment are, how do we know this is actually doing any good? I think when people are seeing cases starting to rise and their children have gone back to school, how do we kind of encourage our population to believe that what they're doing is making a difference and is preventing a further surge in cases? So a lot of the conversations I'm having just indicate people are feeling a bit like they're done with this now, and can we all just crack on? And obviously that isn't the case. We're in the middle of a global situation. So how do we put some of those positive messages out there about what people are doing and how that is helping us to intervene, to manage outbreaks where we see them, and that everyone still needs to keep doing the right thing? Because I think it is understandable. This has been going on a very long time, and people get to a point where they want it to be something different and it isn't. So we need to think about that, I think.
Thank you very much. Sally.
Thanks. Just one other reflection, really. I think people are doing their best to make their symptoms fit a different narrative if they can, and are fearful of being told that they need to self-isolate because of what that means for them and their family, and financial concerns and concerns around their employment. And there's no easy solution to that, but certainly at a practice level, that there are more conversations going on that says, I realise it might not be COVID, but actually you've got a cough, and therefore you've got to have a test and you've got to self-isolate, even if it's not COVID. There's no way of us knowing that. And patients are certainly becoming wise to some of the questions that we might ask, and are framing how they say things in order to try and avoid being told that they have to self-isolate for valid reasons, really. They're being told numerous times to self-isolate for 2 weeks has a massive impact on people's lives, doesn't it? So just a reflection, really. It's no easy answers.
Thank you very much. What I will make sure I do is send a copy of the latest letter to the Health Secretary around the board, because that does pick up some of those points about support if you are having to isolate, and both through to then enforcement if people don't, but they need the support to be able to do it in the first place. And if Claire, if you could pick up Mark and Sian's comments in the next section, that would be great. So thank you all for your questions and contribution. We're in a sense noting Fiona's update on this item, and then we can move on to agenda item 4, which is on communications and engagement, and I'll pass over to Claire.
Thank you. Thanks everyone. Robert, if you could put up the slides, that'd be fantastic, please. Whilst Robert's doing that, I'll just talk you through the first few. So, here we go. So we're continuing to push our key messages, of course, which haven't changed actually for the duration of the slide, duration of the pandemic. So if you can move on to the next one, please, Robert. Thank you. So always wash face, hands, face, space, and then get tested if you need to. And of course, we've reduced that along the lines of the government away from kind of these longer format messaging and reducing it just simply to hands, face, and space. If you'd like to go to the next slide, please, Robert. Again, just to remind you, there are 3 phases to the communications. One about prevent, one about responding to increased cases, which is pretty much where we are now, and the third one, which is around managing an outbreak. If we can move on to the next one. So within each phase, there are various different comms actions that we'll take, and I've shared this with you before. Again, I'll share with you the regular communications, and I'll talk some more about how we have amplified those communications across the city, both in the run up to Tier 2 and then once we hit Tier 2 itself. Next slide, please, Robert. Next one. So, since we last met, we have introduced the daily tweet, which shows cases every day. We report on that and and tweet it out just after 10:30 every day, and share the data in advance with Jorvik Radio, who every day run a half-hour radio program, not so much on case data, but using the case data to start a conversation about the impact the rising cases have on the local community, whether older people, younger people, publicans, retailers, whoever. They have people in talking about the impact of what that means to them, to try and really humanize a little bit of the data so it actually has some meaning and relevance to people. Moving on, please. Again, we're continuing with our regular communications. We're keeping up with our regular emails out to all of you and to our members and our partners. Resident e-newsletter, there's an example of one that went out recently around self-isolation, the direct mail, the booklets, everything, press releases, etc., etc. So we're continuing with our regular rhythm as you would expect. Next slide, please. We've continued to run Facebook Live sessions. So these are two that we ran at the beginning of last week on the 13th of October, which was the Monday, the Tuesday, and the 14th of October. We delayed our one that was due to be held on the 12th of October to the 13th of October due to some delays from central government confirming whether we were going to go into what was then a gosh, I can't remember what it's called, but what is essentially now tier 2. We were waiting to find out whether we would get onto the watch list, and of course didn't find out on the Friday, so therefore bounced our Facebook session to the Tuesday, and thank you very much to the university for bouncing their session then onto the Wednesday. What's really interesting, I think, from this is these sessions have started to really get some resident engagement going. So the session that we held at very short notice on the 13th of October had now it's had over 20,000 people viewing it, lots and lots of questions and lots of people asking for clarity. We then held a repeat session or another session on the 16th of October, which was when we knew we were in tier 2. So again, thank you for everyone who took part on that panel. And again, we were providing much needed clarity for residents who had lots and lots of questions about what tier 2 meant for them. Next slide, please. And the next one. So big thanks to the local media who have really helped and supported us getting out messages. We're taking every single opportunity we can around what's happening with the list or not the list, as to getting out those hands, face, space messages and reminding people of the behaviours that we need to see. These are just some examples. So there was a whole series of stories in the press around, would we get onto the list? Would we not get onto the list? What would happen if we did? And then, of course, we had stories about the Christmas market being cancelled due to coronavirus and what that meant, and the changes to seasonal events. And every single one of these is always about safety and making sure we're keeping people safe first and foremost, whilst protecting as much as we can our businesses and retailers, which continue to be a safe place to visit for people. Next slide, please. I might have talked about this at our last session, but this is just examples of how we've amplified those messages across the whole city in spaces where people can see them really visibly. So we've got lampposts, we've got a banner outside the Guildhall, ward notice boards, the Designer Outlet Centre put some stuff up for us, the racecourse, the hospital car park, that banner's all wrapped around the hospital car park, and then schools themselves. And that's really to try and reach as many people as possible as they're moving around the city and may or may not be wearing masks. So making sure that they think about now's the time to either wear a mask or go and find a mask that they can put on, and of course maintain social distancing. And it partly picks up on the pandemic fatigue issue around we have all shared the information in the usual spaces, and this is to try and disrupt people a little bit and to see things in areas they may not have thought they would see them, to try and kind of capture people's imagination and attention. Next slide, please. Another way of trying to capture people's attention is a very different route for a council to take, and we've had all sorts of feedback from this route, which has been very interesting, really well received amongst audiences that deliberately target younger populations, so the ages 18 to 26-year-olds. And we worked with York Youth Council, Show Me That I Matter and I Still Matter, and the Student Union and universities to help us develop this approach. And this is now circulated on posters on the back of loo doors in pubs, bars, clubs across the city, and shared through partners' social media channels. You won't ever see this on a council social media channel unless we're talking about it, for example, now, because really it's not to target our audiences, it's to target those influencers and those partners who work closely with the younger age group. Next slide, please. This is just to show you examples of how we help to build confidence in the steps that people take and try and reassure them about the behaviours that they need to do, trying to combat a little bit the pandemic fatigue, where we invited people to tell us how they would keep people safe in their own homes, with household transmission obviously rising, and we used an Instagram approach to do that. Thank you for the next slide. And then tier 2 communication. So this all happened very quickly, and I know that's been reported in the media. And really on the Thursday and the Friday last week, we had to quickly get messages out to as many people as possible about being in tier 2 and what those restrictions meant. At the time, we went very much out with what the restrictions are. This week, we've moved into much more of a place of what you can do rather than what you can't do, which I think is helping people with the pandemic fatigue. But I do take your point, Mark, around self-isolation and people feeling that they can or can't self-isolate and what that means to their business. And I think the next phase of our communications really needs to be the support side, where we focused on what people can do and what they can't do. And our next step is obviously how we can support people. We're also, just to let you know, using the frequently asked questions that we publish on the internet, which is on york.gov.uk local restrictions, to keep people up to date with what's possible. And as questions are fed into the Public Health Inquiry's email address, we use that to then populate the frequently asked questions that are published on the york.gov website, to make sure we can share as much information as possible, because we really do understand it is difficult for people to know what they can and can't do, and everyone has so many different questions. Next question, sorry, next slide, please. And then finally, I just wanted to update you on the emotional wellbeing communications that we've talked about before. Next slide, please. We are working in partnership with a number of you on this forum, so thank you very much for joining us and taking part in this. We've recognised, as I know it's been widely reported, I think in the media today actually, the impact that COVID is having on people's emotional health, both as a pandemic itself, but also the fallout, so the economic impact and how that's affecting people's livelihoods and their future aspirations. So working with the partners, we're developing a communications campaign. We haven't got there yet. We're still very much early days, but we have agreed what our key objectives are, which are written there. If you'd like to move on to the next slide. We've looked at our national insight, which tells us, of course, that people don't really talk about emotional health in a work environment, that it very much affects men under age 45, and also children and school leavers, I should say, rather than school, sorry, that is students experiencing anxiety, stress, and low mood and depression. Next slide. This is our own, sorry, that's a bit blurry. This is our own insight from our big conversation, which we've shared with the group the demographic, the information and age, location and gender to help us inform what steps we need to take with the campaign first. And we'll be targeting people through working environment and through peer groups, how we can really start a conversation that makes it okay to say you're not okay, set against the context of some of the very difficult things that are happening in coronavirus. For example, genuine concerns about schools being locked down and the ability to homeschool and at the same time continue to work. Real genuine concerns about businesses and either keeping businesses afloat and paying employees or actually remaining employed. And longer term anxiety around what the future holds and whether there is indeed a future for people. Next slide, please. So we've outlined our communications plan, which we've now published on with these papers. Next slide, please. And we're taking an approach which again is exploring all sorts of different ideas to share our message, and it's still very much work in progress, but it's around really putting on a brave face and saying you're fine when you're very, very much not okay, and how peers and influencers and the people that you talk to every day can actually help move some of that thinking along and help signpost support. There really is a huge array of support out there for people of all different levels. The CVS has done some fantastic things with social isolation and helping people through social prescribing, and we just need to be able to connect people who need the help with the help that's already out there. Next slide, please. And then finally, just to talk about really outbreak communications, we've got already prepared communications and press statements and reactive press statements for those minor outbreaks that are happening in different settings. We are learning a lot from other local authorities. We've learned a lot from partners, and you'll have seen that the Human Rights Steering Group have put in a submission around how we might be able to improve our communications if we're in another lockdown period. We had an incident wash up with partners recently. We're supporting different settings, so as schools have issues, we're supporting them, and we're providing a toolkit of communications material that we're working on now to share with partners for off-the-shelf information, essentially. We're also pulling together community partner briefing sessions, which is really an opportunity to go directly to partners who may not have listened to or have seen the Outbreak Management Board conversations, and take the conversation to them, so we can share some of the case data, share some of the restrictions, share some of the campaigns that are underway, and have a real open discussion about how we can, through them and with them, help reach more people to share more information and attempt to reduce that pandemic fatigue, which as you mentioned is starting to get a hold. Next slide, please. There we go. Thank you very much. So I'd like to open it to questions, and before I do, if I can just say thank you to everyone for being involved. We're working with lots and lots of different partners to get all of this off the ground, and people's support has been phenomenal. So thank you.
Thank you very much for that, Claire. Any questions or comments? I cannot see any, which means you must have answered everybody's questions or comments in and amongst your presentation. So thank you very much for that. Question for me, Claire, which I probably should know the answer to. When is our next Facebook Live? And are we theming it a little bit like you said, because there are a lot of questions at the moment about the restrictions, the changing restrictions, moving between areas. And I think it's really good, as we discussed, to try and do as much communication as possible on that.
Yeah, we're planning weekly Facebook Lives actually, and we're just deciding whether Friday's the right day for them. So we'll be coming out shortly to say when that should be. It's probably not going to be this week, but probably we'll be starting it from next week, either Thursday or Friday.
Great.
And then every week thereafter.
Okay. Thank you very much. So thank you very much for Claire, and obviously we're noting the communications and engagement update, and then we can move on to agenda item 5, which is an update from the Universities and Higher Education Group. Charlie.
Thanks very much, Keith. Speaking on behalf not just of the University of York, but also York St John, York College and Askham Bryan College. The first thing to note is that we continue to see across the institutions a significant number of cases, but with some signs of decline. Not going to count chickens or get complacent, but when I wrote the paper a few days ago, we had 404 cases across the institutions. Currently, it's around about 350. And we hope that is the start of a pattern of decline. Each case continues to be discussed with the city public health team. So we have quite a clear picture of the pattern of cases now. The vast majority are among students. The vast majority are straightforwardly about household transmission or mixing between households. We have no evidence of transmission in teaching settings. We've had good experience getting tests quickly where they're needed. The walk-in centre has been a great help, and it's fantastic to see that in operation. And we've been getting results back quickly as well. So some of the problems that have been publicised in the national system are not impacting heavily on us. With those cases, we have a significant number of self-isolations among our students. That's also decreased significantly in the last few days. Our emphasis throughout has been on giving students in self-isolation good support. So making sure they have access to provisions and services, making sure they have regular contact to check in on them and see how they are, making sure they have access to online resources to support their mental health and well-being, and to have recreational activity. And I think some of our student societies across the institutions have been enormously creative in translating what they would normally be doing in an in-person context to online fun activity. All of that's been quite a logistical challenge given the numbers, and it's been a big mobilisation of students working for the universities and of staff helping to make sure that students in self-isolation are supported. And I think through that, we have a high level of compliance with self-isolation, which we know from wider reporting is not necessarily always the case in the wider community. When the York local area level 2 decision was announced last Thursday, we thought quickly about that. The main change, of course, being the ban on household mixing indoors. The Universities and Colleges Group met on Friday and met again yesterday to think through what our response should be across the institutions to those changes. And we address that under 4 headings. The first is obvious enough and connects directly to what Claire was saying, it's communications, to make sure we reiterate the core messages around hand-face space, but also get the new restrictions, especially on household mixing indoors, into awareness. It is difficult for people to keep track, to be frank. Second area was enforcement, and of course we have penalties at our disposal, but our emphasis, again, following the line that Claire was taking, has been to emphasise the positive behaviours, what you can do and should be doing. And I think that's probably that emphasis, while we will use penalties if we have to, the emphasis on positive behaviours is probably more likely to secure compliance with those measures, or stop driving activity underground. There are somewhat different challenges facing universities and colleges. Universities with large residential populations, colleges with large commuting populations. So we're thinking hard about the different communications and compliance challenges in both of those settings. Third area, and Fiona mentioned this earlier in her presentation, is to do additional targeted testing so that we can understand better some of the patterns of transmission. And we had the first example of that in a University of York setting last week, supported by the City Council Public Health team, and additional examples of that are now taking shape as well. Beyond all of that, we've been working with partners in the City Council, in the CCG for the Vale of York and York Hospital, but also with equivalents in Hull, to see if we can join our forces together in ways which could boost testing capacity for not just for universities and colleges, but for the wider community as well. And we hope that those conversations will bear fruit in due course, and we'll report any developments to this board in due course. The final area of response to the York move into the high level at the local area is to review our operations, and clearly some of our on-campus facilities need to change how they operate, given the restriction on household mixing indoors. And we're following that through in what we hope is an exemplary way in venues on our campuses, but also in some of the recreational activities that are still permissible under the new rules, in particular sporting activity. We want to keep that going because it's very, very good for well-being. We have to manage it in a slightly different way, and we're working very hard to do so. Finally, at the University of York, we are going to be reducing to an extent the level of face-to-face teaching that we see, less because there is an established risk in teaching settings, but there is a theoretical risk because students have to get there and then leave again afterwards, and those points of accumulation outside of the heavily regulated settings of classrooms are something we can look at and try to reduce. We are, though, retaining an element of face-to-face in-person teaching for all of our students. I'd have to say, I may have said this before, but I talk with colleagues in universities elsewhere around the country, and the type of collaboration that we have across different universities and colleges, and with the City Council Public Health team, and with the NHS in various guises, seems to me to be a very, very strong collaboration compared to other areas, and I'm delighted that we have that. I think it's a strength for the city in a difficult situation. Thank you, Keith.
Thank you very much for that update, Charlie. I'll open it up for questions and comments, and also Maxine, I didn't know whether you wanted to say anything from a school perspective, but I won't put you on the spot, but do come in if you want to. I can't see any questions or comments. Maxine, just to double check.
Yeah, just to echo some of the things that Charlie's been saying about the strong partnership across the city. The schools have really maximised their partnership working over the last few months through the York Schools and Academies Board. That's meant that they've developed a very strong relationship with each other, but also with colleagues in public health, and they're in very frequent contact with colleagues in public health. That's been really helping them to scale their response to the cases that they've been seeing over the last few weeks. But as I say, the quality of the partnership we're working has really demonstrated its strength over the last few weeks.
Thank you very much. Sian.
Sorry, I was just trying to unmute and it wasn't working. I suppose the question that I would have is, given that you at all of the higher education settings were very much at the sort of the front face of the sort of the beginnings of what people are thinking will be a second wave, are there lessons that we can collectively learn in terms of what did work immediately, what went smoothly, the hiccups in the road? Because I know what you've just said sounds incredibly reassuring, but I imagine there were some things that didn't go quite as planned initially. Are there things that we can all learn from that in terms of how we communicate next steps, where people can get help, you know, feeding into some of the work that Claire's doing, and things that we as partners can learn in terms of not repeating any, I wouldn't say mistakes, but any things that didn't go quite as well as maybe you feel now, if it all happened again, you could do better?
Thank you very much. We did do an awful lot of preparatory work. You know, some of it starting more or less once we locked down in March, because the mechanism of lockdown became in reverse the mechanism of opening up. So we opened up activity on a measured basis. We have students here all year round, not just arriving in September. So we gradually built up activity on campus rather than going from 0 to 100, and I think that was an advantage. Obviously, the arrival of students in larger numbers was a big challenge. I'm going to answer your question in a slightly different way, because we had the fortune, certainly at the University of York, of starting later. Our term date is later than many, and we were able to see some of the issues that other universities had faced in other parts of the country, where term dates started sooner than we did. And we did see some challenges there, in particular in supporting students who needed to self-isolate in their households. And I think we learned well from those sometimes, you know, quite challenging media reports about some of the issues elsewhere in the country. So happily, we were able to learn a little bit from others. Now, of course, we're now almost halfway through our term. We're thinking now about returning home for many of our students for Christmas and managing the challenge of that. And we will have the return of students in January as well, which will be another challenge. So I think the accumulation of experiences across all of these moments is something we're keen to keep learning from. And with that return in January, we would hope to be in a position not simply to avoid some of the challenges we saw elsewhere, but to avoid having a similar surge to the one that we've seen in our universities in the last few weeks.
Thank you very much for that. So with that, we're noting the update from the subgroup, and obviously thank everybody that's part of it for their continued work. And then we can move on to agenda item 6, which is looking at theme 4 in the outbreak control plan, contact tracing in complex settings. And I'm handing back to Fiona for this.
Thank you. So when we wrote our outbreak plan, theme 4 was contact tracing in complex settings, which at that time was reflective of what we were expected to do at local authority level. So you would have had the national track and trace system doing the majority of contact tracing, and then if there were a complex scenario, that would be passed to the health protection team within Public Health England, who would pick up and do that contact tracing, and then potentially work with the local public health team who could be there on the ground to do any work needed. So since that system was set up with the national system, we have done about 3 visits to premises concerning outbreaks in York to help with that kind of eyes on the ground, what's happening in that local business, and working with our colleagues in public protection to do that. We've also done a number of phone calls where we've done contact tracing with local businesses to help work through what's happening in that business and provide advice. And then also, as you've heard from others on the call, we've done a lot of support to schools to help them work through who are contacts when they've had cases in a school setting, and the universities are also doing a lot of that work, universities and colleges, and we're there to give advice to them if they need it, but essentially they're doing a lot of that work. And I think it's probably just worth noting actually that the head teachers and others within the schools and within the universities have done an awful lot of this work and have become quite expert at this. And it's not their day job, and they found themselves at the front line of this pandemic, and I think it has to be commended how rapidly they've kind of taken on board that and risen to that challenge. It is quite commendable. But what I really wanted to talk about today, and I'm going to share some slides, is about our ambition to do our local contact tracing, working alongside the national track and trace. So in your packs, you've got a presentation which goes into quite a lot of detail and operational detail about how the local service is going to work. So I probably won't go through all of that detail. I think the first thing to say is that we had our first meeting with Public Health England to talk about the possibility of doing this on the 1st of October. And we go live tomorrow. So in exactly 3 weeks, we've gone from having a conversation about whether it's feasible to going for a launch date. So I think that's fairly impressive, and it's been a lot of hard work from our public health team, but also our business intelligence team and our major projects team within the council as well. So the slide here just gives a bit of detail about why we want to take this local approach and some of the reasons for doing that. again, wanting to sort of emphasize that, yes, we want to find cases and manage any particular outbreaks, but what we really want to do is to look at how we can offer support to people locally, and make sure that they're able to follow the advice around self-isolation. So what we know currently, around sort of late 70s, early 80% of people who test positive in York are contacted by the National Track and Trace Service. When we look at other areas of the country who are already doing this, so areas like Calderdale and Blackburn with Darwin, they have increased their contact rate up to in the 90%. I don't know what their starting percentage was from the national, but they've certainly seen an improvement, and they're now contacting 90+% of people. So that's really what we're aiming to do, to improve and increase the number of people we make contact with. So contact tracing is really one of the cornerstones of a public health response to infectious diseases, but one of the benefits of us doing it at a local authority level is that we can build in that broader offer of how we can support people and how we use our kind of local knowledge of the City of York to link in with businesses, others, to make sure we can act much more quicker in terms of preventing any further spread within settings in the area. So in terms of our delivery model, what we'll be doing is initially a 5-day service, but we will increase that to run over 7 days as we get going. Obviously, timing is of the essence in terms of doing contact tracing. What we'll be doing initially is using our existing staff that we have within the public health team, so that we can go live as early as possible, and then we'll be recruiting staff in to run that service. So what we will have when we're up and running is we'll have 5.5 whole-time equivalent staff delivering the service, and then we'll be able to use our existing staff to offer surge capacity. Obviously, one of the difficulties with getting this service up and running is we don't know what the numbers will look like. So if cases go up, there'll potentially be more people to contact, and obviously depending on how well the national service operates will depend on how many people are left for us to contact. So it's a bit of a guessing game, and we need to be reactive and be able to scale up and scale down the staff that we have working on that service. The flow chart that's in the pack really just gives a bit of the operational detail in terms of how the service will work from the point of us receiving the data from the National Track and Trace Service, what processes we need to do, and then how we will look to contact people and put the data into the national service. So I won't go through all of that or the rest of the slides in detail. I think the key things to note from the slides is that at the moment, the National Track and Trace Service will attempt to contact people who are positive for 48 hours. When they can't contact that person, it will then get passed over to us. That's how we'll do it initially. As we get up and running, if things go well, we may request to actually receive that data and do the follow-up after a 24-hour period. So again, we'll be looking at how we can adapt our service as we go forward. We will try to contact that person for 24-hour period. And then if we're unable to make contact over the phone, we will look to visit that person at their home address and either try to engage or leave information with them. Again, it's trying to get across the message as to why we need people to self-isolate, why it's important that we gather details around the people that they have been in contact with, but also to offer them support in terms of, you know, whether they need help with shopping, collecting medications, social contact whilst they're isolating, and making sure that they're aware of the government schemes that can be accessed in terms of financial support to self-isolate. So I'll stop sharing. As I say, I won't go through all the rest of the slides, but they're there for information. And if there are questions that people want to ask us about this, happy to answer that. And then, you know, obviously it's going to be a learning curve for us. So we'll be happy to report back once we're up and running to give an update on how it's been going.
Thank you very much, Fiona. So open that for any questions or comments, and I would certainly welcome an update coming to a future meeting. And once it's been in place a little while, looking at the data effectiveness and what we might do to that moving forward. Danny.
Thank you, Chair. I wanted to thank Fiona for that update and the report, and also, of course, getting the system up and running in 3 weeks is no mean feat. So tributes there, but also I thought it was right that you recognise the work of schools who've been managing this as well since early September. I just got a quick question around the recent media interest in negotiations between government and local representatives. I think one of the key asks around those negotiations has been the commitment to fund a locally controlled test and trace system. So with that in mind, and the potential in future weeks or months for us as an authority to enter negotiations like that, are we preparing for those types of negotiations and a clawback of the funds that we're spending on this system? And have we got enough budget, essentially, at the is the second question tacked to that. But if you could answer those, or if you could answer, Keith, as well, that might be really helpful. Thank you.
Thank you very much. I don't know whether Fiona or Sharon, you want to go first, and then I'm more than happy, or Ian, you might want to add something. Sharon?
So I'll kick off then. So all local authorities received a share of 30 million, I think, that was allocated to local authority public health teams for the pandemic work. So our council share of that was about 173,000, something like that, as a one-off grant. So that's the money that we're using. We've used some of that to support the communications work. We've used some of that money to boost our environmental health officer capacity, and particularly around work with businesses. And we've used some of that money to strengthen the business intelligence team, because there's a big ask for them in terms of all of this work as well. And so the money then is the remainder of that grant we had, plus adding some monies from the existing public health ring fence grant. Now that money won't last forever. We've been very prudent in terms of how we've decided to use that money. We have funds that will probably allow us to staff the service up to December next year. But if the pandemic continues beyond that, and we need to continue with local contact tracing beyond that, then obviously we would be hopefully receiving additional funding in the next financial year to enable us to do it. So Fiona was very modest, but the public health team, my team has done an incredible job on this with the other colleagues Fiona mentioned. Other local authority areas have got a team twice the size of ours to do this work. And I take my hat off really to Fiona in her leadership of the team in getting this up and running so quickly, but also the enthusiasm of the team to go above and beyond what their job description says they should be doing to actually get this work delivered for the benefit of our residents.
Thank you for that, Sharon. And certainly I can add that letter that I sent off this week on being moved into the higher restriction to the Health Secretary called for additional business support, additional funding to supplement what we could do locally on test and trace, but also called for support for a second walk-in centre for the city. Particularly for those other institutions or on the other side of the city that still don't get easy access to a walk-in centre, and obviously what we need is that funding and actions now to prevent and help us from needing further measures in the future, and very happy to repeat those calls jointly or in whichever way is possible to do that. James.
Just a quick question. What other areas are already doing this, and how successful has it been?
So I can't answer for what areas across the whole country are doing it. So certainly within our sort of area up here. So as I mentioned, Calderdale and Blackburn with Darwen have been running this for a while, and part of the kind of program of doing this with PHE is that they've kind of run various webinars, etc. So certainly Blackburn with Darwen and Calderdale have given presentations to offer learning from what they've done. The way that Public Health England regionally have worked is that they have buddied us up with another area to go through the process of developing and going live. So we've been doing that with Sheffield. So I think they're going live this week or went the end of last week. So we've kind of been going through that process so that you've got colleagues who you can kind of then, once you go live, you can sort of share ideas or work out problems together. So we were buddied with Sheffield to do that, but I don't know across the whole country how many areas are now doing it or working towards doing that.
Thank you very much. Ian.
Yeah, it's just to come back on the question around the funding and different tiers and this. I think we shouldn't lose sight of the fact that there are lots of different funds coming in, but they all sort of assume that your overall financial picture is okay. And we shouldn't lose sight of the fact that there's a much wider, bigger picture, which is that most local authorities, if not all, are facing extreme financial pressures, both this year and moving forward next year. I think, though, it clearly makes sense, even if we didn't have the grants, it clearly makes sense to invest some funding to try and get rates down, try and manage this, because actually the return, if you like, from that investment is potentially huge. And so the return from staying in tier 2 or getting back into tier 1 and the impact on our businesses, on our residents, and actually even just directly on the council's finances. So it clearly makes sense to invest some money to try and do that. Just in terms of if a council was to move to tier 3, there clearly is detailed negotiations going on at the moment. Whether those negotiations are as detailed as they have been, if you suddenly get a lot more councils going into tier 3, remains to be seen. Currently, if you go into tier 2, you get, the standard model is you get £3 per head of population of additional funding. If you go into tier 3, you effectively get £8 per head of population as a standard. But those that have moved into tier 3 have received more. They're receiving about sort of just over £20 per head, actually, if you add it all up and make some assessment. Just the final thing I would say is, whilst that funding and anything that's coming to different funds for different amounts for different tiers is naturally welcome. We shouldn't lose sight that overall some of these impacts are not short term, they're not just for 2 months actually, and you know, the impact on businesses isn't just mitigated by paying some grants out for a couple of months. Some of those businesses may not come back, and so that long-term impact is crucial, and that's why it absolutely makes sense to invest in public health measures now to try and, you know, not just mitigate the short term, but actually the much longer term impact on the economy.
Thank you very much for that, Ian. I could see lots of nods agreeing with you. So on that, we can note agenda item 6, and I think minute. Sharon's thanks for the public health team and Fiona for their work in setting that up, and obviously we'll schedule an update on that. Thank you very much. So we can move now on to agenda item 7, which is an update on the National Social Distancing Framework, and this is over to Sharon.
Yes, thank you, Keith. I mean, this was on the agenda really to explain, if for anyone who wasn't already aware, that the government have moved away from the old social distancing framework that we discussed here in previous meetings, with the 3 escalation categories of areas of concern, areas of enhanced support, and areas of intervention, to the new 3 local COVID alert levels, which is medium or tier 1, high or tier 2, very high tier 3. And then just to talk about the fact that York had initially been put into tier 1, but as we all know, we moved into tier 2 last weekend. So that's really all I wanted to say in kind of way of introduction. I mean, I think that we all are probably broadly aware of the additional restrictions that we experience around tier 2. We have the restrictions in tier 1 around hands, face, space, the kind of curfew in terms of pubs, restaurants, etc. And then the additional restrictions around household mixing. But I thought it would be more useful, Keith, to have a bit of a discussion really with partners here about initial reflections really on that, and any particular concerns that partners have around all of this, particularly so that we can identify any further work we might want to do as a board to communicate or to mitigate against any of those issues. So happy to open it up for discussion.
Thank you very much, Sharon, for that. So are there any comments or questions at this stage? I cannot see any indicated. What I think it would be useful is if there is any further feedback, particularly as Sharon says on comms, to please send that in to Sharon and Claire, who I'm sure will have picked up from our earlier questions and conversations some feedback to build into their work. And in a sense, we can note that verbal update. And I'm sure, Sharon, you'll bring us anything back in the future if you feel you need to. Yeah, thank you very much. So that then takes us to agenda item 8, which is the risk log. And I think this is Fiona and Sharon taking us through this. Sharon.
So I'll kick off, and then Fiona's closer to some of the detail of this than I am. So I might bring you in, Fiona, if there are any questions. So I thought it would be useful if the board had sight of the risk log that we use as an outbreak management group. So we have an outbreak management group that is an internal group within the council that brings representatives together from all teams across the council to work on our outbreak control plan. And then from that internal outbreak control group, we obviously have we work out from that with all of the partnership working that we've already discussed in this meeting. This broadly follows the themes in our outbreak control management plan. So theme 1 around is care homes and schools. In terms of our work, we separate that out into care homes and schools. Lee Bell is one of the public health specialists within my team that leads on this. Our aim is to manage outbreaks in care homes, and as far as possible, that prevention agenda around keeping care settings COVID free. This work is not just done by public health, it's partnership work, and certainly the CCG community nursing team is core to this work as well. So as you can see, we have that RAG rated as green at the moment. Ongoing work on this, but no particular concerns or issues in terms of that at the moment. Then going on to schools, Anita Dobson is the nurse consultant who leads on this. Again, working very closely with Maxine Squire and schools, head teachers and schools on this as well. Our aims here are to manage outbreaks in school settings, but also crucially provide support to school staff. So we already have heard earlier in the meeting, this has been a tremendous ask of schools. And we're very conscious that we need to do everything we can to, as a public health team, to support schools. That is going very well, and we haven't had any school closures, and school outbreaks have been managed. But it is very resource intensive. It's resource intensive for the schools themselves. And it's also resource intensive from the public health team. So if we were to see that an increase in outbreaks in schools, that would clearly create staff capacity issues. So that's rated as amber. Colleges and universities then, one of the two of the settings we've identified in the high risk places category. Nick Sinclair, public health specialist, leads on this together with Peter Roderick, who's a joint acting consultant across the CCG and public health in the council. Again, as we've heard already, a tremendous amount of work going on here, and it's rated amber, partly because of the ongoing work that we're having to do around ensuring access to testing, but also the support to the universities and colleges and the amount of staff capacity that is taking up. So very positive work going on there, but it's rated as amber really because of the it's quite resource intensive. Looking then at other high risk places, so this is residential settings other than care homes, so that would include homeless hostels, disability settings in the community, and that's rated as green. Again, an awful lot of work going on here with partners, but at the moment we don't have any outbreaks in these settings. Things are very stable, so that's rated as green. Workplaces then, Natalie McPhillips is the public health specialist who leads on this, working very, very closely with the public protection team in the council and environmental health officers. Again, there's quite a lot of resource intensive work here across environmental health and public health. to react as quickly as we can to where we can see there are clusters of cases or outbreaks associated with particular workplaces. We haven't had any major outbreaks in workplaces, which is really positive. We haven't had any difficulties accessing businesses. You know, even if the team has made an unannounced visit, they've been welcomed. Good partnership working, no enforcement has been required there, because I think of the strength of the partnership working and the level of trust actually that's now being built between you know, businesses locally and council teams. Obviously, there is more work to do around that, and I pick up Mark's point earlier about helping employers, their HR departments, as well as their workforce, understand more about social isolation, etc. So I've made a note of that, Mark. Thank you. So we'll pick that up and look at how we can incorporate that into this work. So that's rated as amber, again, because it's quite resource intensive. Local testing capacity then, and contact tracing. Philippa Press is the public health specialist that leads on that. Huge amount of work that's been done on this, as we've already heard. We're preparing an application for another walk-in site at the moment. We have to identify a suitable site first. That work is happening now. And the discussions with Deloitte and DHSC have already started. So as soon as we get a site identified, hopefully progress will progress on that. And then certainly NHS colleagues will be aware of the priority matrix that's been identified jointly with across the NHS and with Local Resilience Forum and social care partners in terms of who gets priority for tests if they're in short supply. Access to testing has definitely improved. It's a lot better than it was, and it's improving all the time, but there are still issues around timeliness of results coming through. So that obviously there's nothing we can do about that. Locally, it's a national issue, and the government is aware of it, and work is happening on this. But so that's rated as amber. And then we've heard about contact tracing already. That is amber at the moment because obviously our local contact tracing doesn't go live until tomorrow. There may be some teething problems that we'll need to work through, so that's rated amber as well at the moment. Peter Roderick works jointly across the council public health team and the CCG on data integration, works very closely with the hospital as well in terms of access to their data under the public health intelligence team at the council, and that's green at the moment. And then Lee again picks up our work around vulnerable people. The COVID hubs are established well. It's rated green, but we're aware that we need more volunteers to be supporting that work. So there's some further work that's going on at the moment to recruit volunteers. And, you know, again, I'm very grateful to York CVS and Alison's team for all of the, you know, really good partnership working that's happening there. We couldn't do it without York CVS, so huge thanks, Alison, to your staff. And then obviously local boards, that's the governance structure that sits underneath this board. Those meetings are established and meeting regularly, no issues to report, so that's rated as green at the moment as well. So I hope that's been helpful just to give board members a kind of overview of where we are in terms of the themes and where are there some pressures really, and happy to take any questions.
Thank you very much for that, Sharon. Any questions or comments on the risk log, Mark?
Just one for me, Sharon. Feedback from some colleagues across the country in other areas saying that where businesses wanted to report outbreaks or clusters, the response was pretty much, unless it's a food production establishment, the local health teams weren't interested. And I just wanted to check BDS guidance to businesses in York is the same here, or do we as business community report still regardless of what type of business we're running?
Are you able to pick that one up, Fiona?
Yeah, so it's an interesting one. So in any setting where you've got 2 or more cases, that's counted as an outbreak. So if it's deemed as a fairly non-complex setting, then obviously the National Track and Trace program will identify contacts, give advice to people. If it's more complex, so for example something like a food factory or something like that, where it's a bit more complex, then the National Track and Trace program will pass that over to the local health protection team at Public Health England and ask them to get involved, and that's where we locally might get involved to do a visit if we needed to visit that premise and kind of work out what measures they had in place. So I don't think it's that they're not interested, but obviously depending on the environment, the response may get escalated to be dealt with at a more complex sort of and specialist level. I suppose one of the things that I would say is that sometimes businesses, they'll get the advice from the National Track and Trace program, but actually they maybe then need a bit more support after that initial information to then kind of work out and digest well, what does it mean for me here in my business, and what HR advice do we need to give in terms of how long am I saying that these people have to be off work for, and all of that kind of stuff that maybe comes up after an initial call with the national team. So we have tried to be as open as possible within the public health team to make ourselves available, and we do get a fair amount of inquiries from businesses when they just want to ask about those kind of questions, so we're always happy to do that and talk through with businesses if they want to get that support. And I know that colleagues in public protection, environmental health officers do that as well. So we're happy to support businesses when they've got those kind of queries.
Thank you very much for that, Fiona. I can't see any other questions, so if we can note the risk log as presented by Sharon, and then we can move on to agenda item 9, which is items for the next agenda. So it's just an opportunity for any board members to put forward items for the next meeting. If not, please do submit them after the meeting, and like previous meetings, we'll add them for the future. We've got for the next meeting, obviously the current situation, your communications update, and also updates from subgroup. We've already had one request in advance. So York CVS and Health Watch have produced a report what we did during COVID-19 lockdown March, and I understand that there's a request to bring that to the board meeting with a bit of a presentation in November, which I'm more than happy to add to the future agenda. James.
And it might want to be for the meeting after, given this, that you've already got your agenda for next time, but I just think it'd be worthwhile bringing something on the economy, and in particular unemployment, as we move from furlough onto the different support scheme. We'll start to get some numbers for what increases in unemployment's looking like, which has obviously got knock-on impacts on health and other issues. So I just think at one of the next few meetings it would be useful sharing some of those trends.
Thank you very much, James. And again, I could see lots of nods as you were suggesting that, so I'm absolutely sure it's something that we'll schedule. I can't see any others, but please do send them in as I mentioned. That then takes us on to agenda item 10, dates of the future meetings. So our next two meetings are on the 18th of November and the 9th of December. And obviously we'll then look at board meetings as we go into 2021 soon. And then those potential dates will get circulated to board members. Just making sure there are no questions about that. If not, if we note those dates, and then we'll pick that up outside of the meeting. And then finally, we move to agenda item 11, any other business. I've not been told of any, and I don't have any. So unless somebody waves at the screen now, just to say thank you to you all for your time and participation and all of the work I know that your different partner organisations and our public health team are putting into this in York. And obviously we'll see you all for the next board meeting. Thanks all. Bye-bye.
Thank you.